Let's find out a little more about hypertension today with Safia. Hello everyone, my name is Bianca and welcome to my channel Be Silver. So a few days ago when I started sharing the Sow Blood Pressure UK 23 Sewing Challenge over on Instagram, the lovely Safia, who is the Curly Sewista on Instagram as well as on YouTube, she shared my post to her stories and mentioned that she helped people to manage their blood pressure. So I was a little bit cheeky and asked her if she wouldn't mind sharing some of her sewing knowledge with us. If you are unfamiliar what the Sow Blood Pressure UK 23 Sewing Challenge is all about, please go ahead and see one of my previous videos. But for now, let's go and chat with Safia. So, thank you for accepting to do this with me today. I wasn't expecting to invite anyone to kind of do an interview style, but really thank you for joining me.
Fine, it's okay.
Could I ask you to just introduce yourself and just tell us a little about what it is that you do?
So, my name is Safia. I'm the Curly Sewista. So by day, I work as a practice nurse in a GP surgery. So I manage a lot of long-term conditions at my surgery. So I manage diabetes, cardiac disease. I also do asthma and COPD as well. But um, involved with the long-term conditions like diabetes and cardiac disease is hypertension. So that's why obviously you've invited me here today to interview.
Yes, of course. And I'm trying to educate myself as well today because I haven't really, although my dad passed away from it earlier this year, I haven't really, let's say, done a real investigation of what it all is, what it all means. So I'm kind of going to be learning from you a lot as well. So I've got a piece of paper here as well so that I can take some notes. So if I'm looking to the side, that's just what I'm doing, okay?
Yeah, no, that's fine. I've got
So
my phone in on messages that is crying, but my little baby's crying. So if I look down, that's just for that as well.
that's okay, no worries, no worries. So could I start with what exactly is hypertension and what causes it?
So yeah, hypertension is really basically it's where your blood pressure is high. So it's where the blood flowing through your blood vessels is going at a really high rate. When we say high blood pressure or hypertension, it's normally then with figures, so targets. So people have that idea that 120 over 80 is the ideal, which it generally is. But with say hypertension, it's generally if it's over 140 over 90. Um, Tell me if I get too technical as well, like because I'll just continue on
Yeah,
and on.
yeah, that's okay, yeah.
The top figure, which is the systolic figure, and then you have the bottom figure, which is the diastolic. So if one of them, generally they both will be raised then. So if you think of your heart as like, you have the four chambers of the heart. So the ventricles at the bottom, when they kind of squish together, that's when all the blood flows through your body. So that initial contraction when that happens, and that's when the blood is flowing, that's the top figure, so that would be like the 140. And then when the ventricles are at rest, that will be then the bottom figure, which is the diastolic figure. So as I said, 140 over 90 over that figure then would be classed as hypertension. So yeah, that would generally be classed as hypertension. So if you wouldn't just go off one reading. Normally, we like to do an average of readings. So if you came to the doctor's surgery and if it was raised, they'd normally get you in on the second day to do another one, or they might send you home with the machine. A lot of people, funding problems sometimes that we have, so we can't give everyone a blood pressure machine. So some
Yeah.
people will just in and then we give them a sheet and then they'll do an average. So sometimes we do have something called an ambulatory blood pressure monitor as well, where then you'd give somebody that and then they'd wear that for like 24 hours, where we'd say to people, continue as you would normally. So one of my friends was saying that her dad was given one, and then her mum was saying to the dad, now make sure you don't do this and start mowing the lawn and start doing this. And she was like, no, mum, just this is the reason that they put it on, because he's just supposed to do whatever you do normally.
Yeah.
To get him to start mowing the lawn and stuff, which you wouldn't normally do at 83. But yeah, so normally just to see an average of what it would be in your normal day to day.
Okay.
So
All right. So because you spoke about that machine, is that the best way for someone to monitor themselves at home?
So, the ambulatory blood pressure, well, that's normally put on at the surgery or at the hospital, and then you don't touch that, you kind of leave that on. But a lot of patients kind of don't like that because it can be going off when they're asleep as well. So,
Okay.
if it's going off when they're asleep, that would obviously make them stressed or anxious, and then it can kind of raise their blood pressure. So, in our surgery, what we normally do is would lend them a blood pressure machine and give them like a little sheet to fill in, where they do 2 in the morning, 2 in the evening for a full 7 days, and then they drop that into us, and then we work out the average. So it's we show them how to use the machine then, and then work it out that way. So that's normally what we'd generally use.
Right.
Yeah.
Okay. I've actually thought of getting a machine myself,
Mm-hmm.
because apparently it's hereditary, is it? Hypertension?
It can be, yeah, it can be.
So it's just worried me a little bit that there was complications with my dad. Well,
Mm.
he knew he had it, but he never did anything about it. So that concerns me now. That's what happens if it comes over to the rest of us, like me and my sister. So I think I will be buying one in the near future just to keep me checked as well. Right?
Just a little bit for that though, but you don't want to be measuring all the time because then that could be a little bit
So
stressed. Well,
how
then
often then should we check it now that you say that?
I mean, I'd normally say maybe just once a week or something. You could check
Okay.
it. Yeah. And then if you notice that, oh, it is a bit high actually, maybe just check it the next day as well. But some people can become a little bit obsessive with checking it, which can then that can become unhealthy in its own as well
Yeah.
then.
Yeah.
Mm. Yeah.
Right. Okay. So what are the risks then if you don't monitor it, so you wouldn't know you have high blood pressure, and then you're not controlling it? So what is the risk of not controlling it?
So, with blood pressure, a lot of the time people don't have any side effects of it. So, they'll come into the surgery and be like, we'll check them, and then they'll be like, your blood pressure's high. But then I don't have any side effects. And then it can be put to the back of the mind then. So the risks of hypertension, having high blood pressure, then is if you imagine the blood really rushing through your blood vessels, the damage that it can do to your cardiac muscles, to your kidneys. So one of the smallest blood vessels that you have in your body are in your kidneys.
Mhm.
So if you imagine blood flowing really fast through those blood vessels, when the blood's there's lots of things that are incorporated in your blood. You've got cholesterol, plasma, all sorts of things. So when that blood's rushing through those vessels, the faster it is, it can cause damage to those blood vessels. So it can, cause that damage, and then other like white blood cells will come and they'll kind of plug the damage, and then they can become bigger, and that can lead to something called oh god, it's gone out of my head. Like an aneurysm, because it can cause the blood vessel to occlude, so then the blood flow doesn't go through. So that can, in turn, basically it can lead to heart attacks, strokes, kidney disease as well. So they're
Okay.
the main risk factors of high blood pressure. Then,
And
um,
you
yeah.
also mentioned cholesterol. So if a person has cholesterol, that adds to the risks of what you have just said. Is that correct?
Yes, if you think of like your water at home and that's running through the pipes, cholesterol will stick to the sides of the blood
Yeah.
vessels if you've got increased cholesterol. So it can cause like a furring up of the blood vessels. And if you think that blood vessels, or if it's like this, the furring up of the blood vessels, it makes the blood vessels smaller
Yeah.
and thin, so the blood doesn't have enough um, it's going to be rushing through. And again, that can cause plaques to break off, which can lead to strokes. It can cause a blockage, which can lead to heart attack. So yeah, cholesterol, it can, cholesterol, high blood sugars, then it all goes back to high blood pressure as well in the
Yeah.
beginning.
That is something else that I'm worried about because I suffer. Well, I don't want to say I suffer, but I do have high cholesterol as well, a higher rate than what would normally be. And I have had to be under like a nutritionist program in order to get my cholesterol levels down. So that is just something else that
Mm.
scares me about the possibility of inheriting, let's say, certain conditions from my dad. So yeah. Yeah.
If it's over a certain amount, I think it's if it's over 7.5, then you can be referred to a special clinic for familial hypercholesteremia, where they'll say, you know, it is inherited really. But then they can start you on treatment like statins and things like that if they deem it appropriate.
Okay. So I know because I wasn't a nutritionist that there's lifestyle choices that you can and need to make in order to not only lower the risks of cholesterol, but mainly this is because of high blood pressure that we're talking. But it's the same for high blood pressure, correct? That
Yeah.
there's certain things that you need to eat and do, or lifestyle choices, let's say, in general, that we need to do in order to lower blood pressure if we have it. Can you tell us a little bit about what it is that we need to do?
Yeah, so lifestyle factors that can affect like cholesterol, how you said, there's obviously the fats in your body. So if you are carrying more weight as well, so obesity, we know that can have a huge impact on blood pressure as well, because it affects cardiac output. So your heart's going to be pumping faster and at a deeper tone as well, and that can cause obviously your blood flow to be higher, which causes the blood pressure to be high as well. Alcohol intake, increased alcohol, that can have a huge impact on blood pressure as well. Alcohol can affect the release of renin hormone, which in turn causes the blood vessels to constrict. So the blood vessels are slightly then they constrict and become smaller. So then obviously it causes that resistance when the blood's flowing through, which in turn then causes the blood pressure to be high. Smoking, that can have another impact on blood pressure as well. So if you're a smoker, nicotine causes stimulation of norepinephrine and epinephrine, which is the hormones which cause your heart to beat faster and harder as well. So smoking can be another factor for blood pressure. If you're not very active as well, again, that can have an impact on blood pressure. They're the main. Stress is a big impact. Obviously, we can't all affect, you know, wish you could remove all the stress from our lives, but stress can have a big impact. So, you know, talking about stress that you have in your life, because of the cortisol levels, that can affect blood pressure. What else off the top of my head now? The salt intake also has a huge impact, because it can, the amount of sodium in your blood, that can affect how much fluid is in your blood vessels. So if you've got increased fluid, that, you know, that's going to be more blood flow really. So again, larger blood flow flowing through your blood vessels, again, high blood pressure. So they're the main ones that I'd say.
Right, okay. That's quite a lot actually. And sadly, those are all things that my dad used to do. He never used to drink alcohol because of certain medications he was on, but he used to smoke a lot, never really did much physical activity, and really liked salt in his food. So he wasn't helping himself either, making those choices. But okay. I've also read that there is medication that can be taken that obviously needs to be prescribed. Is that correct?
Yeah, so the medication needs to be prescribed. So that's why I said when we initially get someone into the surgery, we wouldn't just go off one reading, because someone could be running late to the appointment, anything. There can be, if you've heard of white coat hypertension as well, that's when doctors used to wear white coats, and patients can come in and they feel anxious when they come to the doctor's surgery sometimes. So it can be falsely raised as well. So that's why they termed it white coat hypertension. So that's why we wouldn't like to start someone on treatment straight away when they come in from one reading. We like them to do the average. So yeah, there's not generally about 4 tablets that we can start people off on. One of them is a ACE inhibitor, and how that works is very basically it dilates the blood vessels. So if the blood vessels are constricted, then it dilates them, allowing the blood flow.
Yeah.
And therefore reducing the resistance, and then reducing the blood pressure. Another one is calcium channel blockers as well. How they work is they reduce the amount of calcium getting into the heart muscles, and then that in turn again can dilate the blood vessels as well. So again, reducing blood flow. Another one is diuretics. So some people so one of the side effects of hypertension can be heart failure as well. And some of the stages of heart failure can be swelling in the lower legs. So older people might realize that some notice that they have like edema where they have swelling in the ankles and the legs and things. So basically diuretics would cause the kidneys to then you'd urinate out more urine, get rid of some of the fluids, which in turn would then again reduce resistance and then reduce blood pressure. I think that's all of them. Beta blockers. Beta blockers can be used in two different ways, but mainly to reduce the cardiac output, so reduces how much the heart is beating, which in turn then would again reduce blood pressure as well.
Yeah. And any of these medications, do they carry side effects?
So yeah, all medications can have side effects. When I look, because I'm a nurse prescriber as well at my surgery, so we have to always check with interactions with other medication that people might be on. So we'd always have a check there, and then I won't list the side effects to anyone. I would say if there's anything out of the norm, or if you have any side effects, and obviously get back in touch with us, because sometimes to people this side effect, they will have one of those side effects. So we kind of just say anything out of the norm, just stop taking, let us know that you're having those side effects. So yeah, one that's just coming off the top of my head is someone had a cough for a really long time, like a dry cough. They were investigating for asthma and everything, and then we realized that it was one of the ACE inhibitors that they were on. This would just only happen the other day. So yeah, that can be something as well. But again, if they had a problem with one of the medication, you'd then try them on something else then.
Yeah. All right. Okay. That's interesting as well that you say you don't tell people what are some of the side effects, because some people might be searching then on themselves for those side effects, and they might even just bring them up by themselves. So that's interesting.
If there was something, for example, like with amlodipine, one of the medication that we can prescribe for hypertension, you might get swelling. How I said, swelling in the lower legs and the ankles. So we might say that might be one of the side effects. And if you do have that, then let us know, because obviously that's not something that we want them to ignore. But I won't list a whole list of side effects and say this, because number one, they'll probably say, you're all right, I don't want that tablet actually, I'll just stick with the blood pressure. We don't want that either.
Yeah. Okay. And is there anything else that can be done apart from the lifestyle choices we have spoke about? So physical activity, the smoking, the alcohol, and the medication. Is there anything else available for people to explore to help out?
In terms of,
I don't know, maybe like I don't want to go down the route of meditation and things like that, but are there any maybe natural remedies or like certain herbs, or I don't know, is there anything else that can help, or is it just what you have spoken about earlier on?
Mainly what we've spoken about. So I'd say the lifestyle factors, I would always encourage people to make those lifestyle factor changes initially before we start medicating people. But then obviously, say if we got something earlier on, so we'd say a lot of patients will say to us, can we please make some changes first, and then we can, if it was high, at a higher level, probably wouldn't say that. Would probably say, no, we need to start you on this. A lot of people then would start on the medication and then make lifestyle changes.
Okay.
And we'd say, well, actually, we could trial you off the medication now, and see how your blood pressure is. And then a lot of people will say if they've lost a lot of weight or something, then they can come off some of the medications that they're on. In terms of holistic things, there's nothing that there's been a huge amount of research on that I would then recommend. Obviously, holistically, like Pilates or yoga and things, they're all good at bringing stress levels down. So they would obviously always work on like, you know, if you were stressed or and things like that. I'd always recommend, you know, but I wouldn't forego medication for that really.
Yeah, I was just asking it as in helping, not a replacement, but helping like lower the blood pressure. All right, okay. I'm educating myself today. I'm really enjoying this. So I used to be a cabin crew, but also I used to instruct. So I was, for the first 7 years of my career, I was just a cabin crew, but then I got promoted and became an instructor. So I was teaching pilots and cabin crew on emergency procedures, safety, security measures, dangerous goods, and first aid was one of those things that we needed to go through. Now I know, let's say, basics of first aid. I don't know a lot about it. We needed to know like the minimum just to help out in the air until we could land the aircraft. So it's really interesting to dig a little bit deeper into certain aspects of it. So I'm really enjoying what we're going through today.
Well, I don't want to become too technical because you can go down the real route then with the hormones and the heart and everything. But yeah, a lot of the thing with blood pressure is like at our surgery, we and this is like with POF and GP surgeries and everything, we are encouraged to check everyone's blood pressure every 5 years. So a lot of the time, how we would do that is, because that's how GP surgeries get funded, is we would do the work and then that's how we get paid then if we do certain work. So I remember when we were running one of our COVID clinics, a lot of the patients that were coming in, we had one person that was checking blood pressure, because there'd be people that just don't come to the surgery at all. A lot of people, that's why pharmacies are really helpful at the minute as well, because patients will go in for, say, to collect the pill or something, although we would check them. Say if they've had I don't know, chest infection, they'd never normally go to the doctors. They would then say, you're here, can we check your blood pressure? And there's been a couple of patients that they've checked their blood pressure while they've been waiting for their prescription, and then they've noted that they've got high blood pressure. So a lot of the time people don't have the symptoms. So would never normally get checked for it really. Recently also there's been with the Apple Watches, or other Google Watches and things that they're really well. We have a lot of people coming in and saying, my blood pressure's quite high on this, and then we'll check it that way as well. Then it's always worth getting checked out.
All right, that's interesting that technology is helping out the process as well. All right, that's interesting. Okay. From your experience, because you have probably dealt with a lot of people who suffer from hypertension, do they always come back to you for checkups? Is that correct?
Yeah, so we try to get patients to come in annually for hypertension reviews. Our surgery, we do it on their birthday month so that they remember to try and come in as well. But we have a process where we invite all our patients who are on the hypertension register to come in and have their blood pressure. Again, technology helps, because we sometimes would then because we have like a list of patients who haven't attended, so we'll send them a mass text message to say you need to come in and have your blood pressure checked. And then again, when they're on medication, normally when they've gone to collect it, the pharmacy again would kind of check it as well for them. But yeah, annually normally, because when you're on certain medication for hypertension, we need to check your kidney function every year to make sure, because as I said, some of the medication processes through your kidney, so we need to make sure the kidneys are managing okay with it really. So yeah.
And do people their mental health, does it affect them in any way? Like, do you generally see maybe a decline in their mental health?
So polypharmacy, sometimes when patients are on lots of medication, it can really get them down. So you'll do a medication review with them, and they'll be like, well, I'm on all these tablets, and it can be a little bit depressing for them really. And then we have social prescribers at our surgery, which they can talk to, because they have time really. You have that little 10-minute, 15-minute window to see them, so it can be difficult. So that's why we do then we would then prescribe them, book them in an appointment with, say, a social prescriber that would be able to speak to them as well. Yeah. Also, as I said, I manage a lot of long-term conditions, so diabetes and cardiac disease as well. So again, we'd always, on the templates that we use, one of the questions that we always ask is, how is your mood? So that can sometimes and they can open up about how they're feeling in terms of, medications and how they're feeling with the blood pressure. Some patients can get down with the diuretics that I mentioned. So one of the tablets is water tablet, so to speak, so where they would urinate out the extra fluids. So some people can find that really limiting for their life because they have to plan the day around when they take the tablet. So they find that a little bit difficult as well. So we always discuss how they can take it maybe earlier on in the day so that it doesn't affect them when they're going out and things then, because they don't want to have accidents when they go outside them.
Of course, yeah. So in your clinic, you have that option available where you can book people in to speak to another person, to a professional. Do you know if that happens in other clinics? Or are you able to answer that question?
It should do. I mean, I'm not sure if they're based. I work at quite a big surgery, so a lot of different professionals in our surgery. So, and we work quite closely with them as well. So we would, we see them at meetings and things like that. So we would, I'd just be able to look at the social prescribers clinic and say, I could book you in there, or we could just send her a message, really as well. But there should be social prescribers at other surgeries as well, maybe not based at that surgery, because a lot of surgeries are very small as well, so they might have to outsource them. But
okay, all right, that's good to know that there's people available to talk to if they're feeling down.
Yeah, definitely. Also, I find the British Heart Foundation is amazing online for resources and for some older patients might not and don't have internet access, or they might not use forums and things like that. But younger people, I always, direct them to the British Heart Foundation. There's lots of people that they can talk to that are in the same situation as them. So yeah, that's always loads of information there as well on there.
Right. Okay, that's good to know. I'll actually go and have a look then at their website.
Yeah. And the one really good thing about the British Heart Foundation, it's not guided by a drug company as well. It's kind of, it's very basic information that's not there's no kind of agenda really behind it, so to speak, as well. So like the difficulty we have sometimes at our surgery is people read sensational headlines in the newspapers, like, stop taking a statin, this causes this, and then they'll come in and people are like, oh, I shouldn't be taking this, but then it's just the sensational headlines that get people. So yeah, there's always just, really basic information there.
Right. Okay. All right. We've covered everything that I actually wanted to talk about, but is there anything else that you think we didn't talk about that needs to be mentioned?
No, I think I've babbled on for enough, really.
Yeah. Oh no, that was lovely. So just before you go, just on the sewing front, do you have anything on your table right now that you're working on?
Oh, I'd be so ashamed to show you my table right now. I'm in the middle of moving, so at the minute I'm actually organizing my stash. I'm kind of, I had all my fabrics folded. If you can see, like, folded on top of each other. I'll get one fabric and a whole avalanche, and I thought, no, I can't continue with this. So I can see behind you, I've started rolling all my fabrics, and I had loads of fabric that I didn't even know how much the width and stuff was. I was measuring them all, rolling them all, putting them all back. So yeah, I'm not actually doing any sewing at the minute, but work in progress I do have is another Gilbert shirt top closet. So because they're so good for summer. So
yeah, I'm trying to get summer ready as well. This is actually one of the latest ones that I made.
Is that, a sagebrush?
Sagebrush top, yeah. I think I made this like last month or 2 months ago, just trying to slowly get my summer wardrobe ready, because every year comes and I never have any summer clothes to wear. So this year is the year that I'm slowly getting some pieces in there. Are
I'm
you
always
gonna?
like seasons behind, really.
Yeah, I feel that because I'm with that as well. Sorry, I just had something pop up here. Oh, unlimited. It's saying running out of time. I'm not sure. Oh, remaining meeting time, 10 minutes. We should be good anyway with that.
Yeah.
Are you gonna be able to have the time? Because you've just said now that you're moving homes. Are you gonna have the time to be able to participate in
Yeah,
this
fingers
challenge?
crossed. I kind of always have sewing on in the background, so I might do because as I said, I've got a little boy as well. So
Yeah.
when the time I always have that little, like an hour maybe to just quickly sew something up. So yeah, loads of ideas, loads of plans, but it's just time, just a lack of time, really.
But that's
Yeah,
it. That's the whole um why I've decided for the challenge, take something off of your list because
yeah,
I think most, if not all of us, we have these lists and we just keep putting items on the list without really having time or for any other reason. We just put it off, we put it to the side. So this is
yeah.
why for the challenge, I was thinking, no, grab something from that list and let's get it done now. Just one item for the year, just get it done.
And that'd be good for decreasing the stress levels as well. Then getting rid of stuff off your list as well.
Exactly. Tick. That's done. Let's move on to the
I,
next one now.
I like writing stuff on my to-do list just so I can tick it off then as well. So
My wall here, it never pops up in any of my videos or even in the camera, but my wall here is like got 4 A4 pages on just things written down on it, like
oh,
projects to do, patterns to buy and things like this. So
oh, I have everything on my phone. So my phone. Have you used Stash Hub? I'm using that at the minute. So it's amazing.
I haven't used it yet. I've just got the free version, but it's limited
Mm,
to 20, and I think you you can maybe
but
see that 20 is not going to be enough. So, and I was
yeah,
earlier on trying to sort out my pattern stash.
no.
It's, I just kind of put it by categories, just, bottoms and then tops and dresses, but that's as far as I went. I couldn't do it like any more detailed than that because I've got like maybe 200 or more. I'm even too embarrassed to say that, but yeah, I've got a lot of patterns.
I've got loads. And so much fabric. My thing's fabric, and when it's electronic PDF patterns as well.
Oh yeah.
I don't then because it's out of sight, out of mind, really. And I
Yeah.
bought more fabric today as well. Like I'm literally sorting out my fabric and saying, "Oh my God, I've got too much," and I literally bought more today. Like, why? Why do I do that?
I mean, it's a completely different hobby though, fabric
It-
purchasing. So I've actually been good this year. I've done, I think, only 2 fabric purchases, but they had intentions and I used most of the fabric up. Because other than that, I'm saying to myself, no, use from here first before you purchase anything else. Because it's quite easy, it's quite quick to build
oh.
up a stash. This whole stash was built during COVID. I mean, and we were only a few months in, or not a few months, let's just say nearly a year into it. And
Yeah,
this was like mostly built up already. So,
yeah.
but yeah, I've got a lifetime of fabric here.
Because it makes us happy. It makes me happy just like having a look and pulling it out, stroking it. So whatever makes you happy, I say.
Of course. And if there's no bad habits, let this be the bad habit.
Exactly.
Safia, thank you very much for being available to do this with me
Yeah,
today. I hope that this educates more people out there as it has educated me. And yeah,
yeah.
that's it.
Oh, it's nice to see you.